So feeding therapy is considered, especially in children, if children are not growing. That's always a red flag. When children have very restricted diets, and true, all toddlers will go through phases where they don't want to eat as many foods as they used to, because food is a control issue. And for a toddler who's told when to wake up, when to go to bed, when to eat, when to go to school, food does become a control issue. So we're talking about feeding issues and picky eating that goes beyond typical toddler, goes beyond that typical control toddler. So for a child that used to eat maybe 10, 15 foods, was confident in seeing those foods prepared in a variety of ways, when that stops happening, when the child is insisting on certain foods only being prepared a certain way, or maybe foods only coming from a certain box, like it has to be the same brand, we're finding those foods choices going down from, say, 15 down to 5. We see children that have significant anxiety around food. We've seen some children that when mom or dad tries to introduce a new food, a complete temper tantrum because there's just a lot of anxiety. And when kids don't have the vocabulary to say, when I eat this, it feels like it's going to get stuck in my throat, or I have worsening pain in my chest after I eat this, they just don't eat. And that's a self-preservation mechanism because they don't have the vocabulary to tell us. So what we look for, again, are those really restrictive, controlling behaviors, looking for a significant amount of anxiety around food, especially in older children, and those food choices become more and more limited. And especially in children, we worry when they stop growing. Whatever their growth curve is, whether it's 5th percent or 50th percent, when they fall off of that growth curve, that's when we get concerned. And certainly, if they're being monitored on a regular basis by a pediatrician, or that we're concerned about other types of food allergy, then we will certainly be doing some blood work and monitoring for nutritional deficiencies. And again, in an adult, we're looking for, again, increased anxiety around food. Maybe some adults may decide that they want to stop going to parties because they're just really concerned about not having anything to eat there.